the time to join us today. Today's session is a training guide to rigid endoscope education and usage. So throughout this session, we will look at all the aspects of rigid scopes to hopefully give you a better all-over understanding. I'm also joined today by Nick Williams and Dan Call, Managing Director of Surgical Holdings. I'm just going to pass over to Dan quickly, who's going to talk a little bit more about our educational side of things.
Hi, good afternoon, everyone. Thanks for joining us. As Mark says, just a bit more information really on our educational program and what we're doing and what we're developing currently. Thanks to those of you who joined our surgical instrument sessions a couple of months back. So just to share with you, we're hosting these sessions after they've gone out now on our YouTube channel. So that's on the right. You can see that there. Lots of different videos and information there. Educational information. So any previous webinars we've done can be found on there. The webinar itself is CPD accredited, so you'll see down there you can find the webinars on the CPD website. After the session's finished, we'll send all of your details over to CPD and they issue the certificates directly. So if you've been on our previous webinars before, you'll get the certificate through. It normally does take a little while, but it does come through. So appreciate your patience with that. Finally, just to highlight, we're on Spotify as well. So these webinar sessions go onto Spotify. So if you wanted to listen to them, they're accessible through there. We're going to be adding other audio sessions only on there as well as we go along. Finally, if you've got any questions, please put them in the chat rather than the Q&A, and we'll pick them up as we go through. I'm going to drop off now and hand back over to Mark. Thank you, Mark.
Right, thanks, Dan. So yeah, thank you again for joining us. Obviously, if it's anyone's first time here or anyone's unaware of Surgical Holdings, I'll just give a brief overview of who we are as a company. So we're a family-run business employing over 60 people, based down in Southend-on-Sea, and we've been in business over 35 years now. We are a UK manufacturer and repairer of all types of instrumentation, including general instruments, power tools, and most importantly for today's session, endoscopes. So what is the purpose of today's presentation? So hopefully it's to give you an insight into the construction of a rigid scope, common faults that we find, and how to identify those faults. Hopefully in turn this will increase the knowledge for the users and help to reduce any further wear and damage to your scopes. Why are we able to talk about this firstly? So we've been repairing scopes now for coming up on 10 years. We have 7 technicians currently with a combined experience of 50+ years. And on average, we repair around 1,800 scopes per year. So as you can imagine, we've seen it all here. So what is a rigid endoscope? So in very basic terms, a rigid endoscope are made up of fine metal tubing, which house optical lenses and light fibres. They give the surgeon a visual aid when operating via keyhole surgery. So these are available in different sizes and a large range of external diameters, typically anywhere from 1 to 10 millimeters. Endoscopes can be forward viewing, which we call 0 degrees, or angled anything from 10 to 130 degrees to allow visualization out of the axis of the telescope, increasing the FOV, which is field of view, by rotating the instrument. So I mentioned field of view there, which we're going to look at a little bit further down the line. So just a brief history. So whilst researching this, so earliest signs of a primitive design of endoscope dating back to ancient Greek times have been found in the ashes of Pompeii, which is pretty incredible. Obviously nothing in comparison to what we have today, but the first signs of endoscopic surgery. So moving forward in time to the 1800s, so Philip Bozzini attempted the first look inside a human body through a metal tube, which sounds pretty terrifying. This was actually during a war against the French. He created a basic instrument designed to inspect gunshot tracts. Moving on to 1853, a French surgeon developed an instrument specifically designed to examine the urinary tract, and he named it endoscope. So this was the first time in history that term was actually used. Another interesting fact, this was actually developed and practiced on a sword swallower at the time. So I'm not sure what's worse, an endoscope or a sword. Moving on to 1858. So Dr. Kalsmel succeeded in looking into the stomach of a human. 1881, a famous Viennese instrument maker adapted the design to include electrical illumination. So here we can start to see sort of a more common theme with the endoscopes that we see today. You've got your visual and your light. In 1930, the first 135-degree scope was created. Obviously, this was a big change in application, allowing better field of view and suitable for more surgeries. 1950s, probably most importantly, Howard Hopkins, you may have heard of, a British physicist, designed the Hopkins lens, which is still used today. And then moving all the way forward to 1986, the first video laparoscope was created. Obviously, there have been some developments since then, things like 4K and 3D scopes now being available as well. So let's start by looking at the internals of a rigid endoscope. So here you can see this is an exploded view of a scope broken down into its individual parts. So rigid endoscopes are primarily made up of a series of intricate glass rod lenses. So each rod lens is separated by a spacer. You can see these spaces here. So you've got the rod lenses here, spaces in between. So the distance of each spacer is calculated to achieve optimal clarity throughout the entire image. So these fragile glass lenses are encased in a steel inner tube. So we can see now surrounding the internal tube, which houses the ocular system, there are hundreds of glass light fibers, which you can see at the top here. So these light fibers transport the light provided by an external light source directly into the body. These hundreds of light fibers are encased in a steel outer tube, measuring the diameter required for the necessary procedure. So each component of a rigid endoscope is fragile and can be easily damaged during any procedure, as we know. But going back to field of view, which I mentioned earlier, so this is quite a nice visual, just to give you an idea. So this is an arthroscope. This has a 30 or a 70 degree field of view. Obviously, the reason for this, it's important for certain procedures where limited access or space is available. So trying to do, say, a knee arthroscopy with a 0 degree scope wouldn't be possible. A big part of repairing these scopes is very important that the light fibers are also matched to the viewing angle of the distal tip. Otherwise, you'd have your light pointing in one direction and your field of view in another. So most scopes have many intricate parts, as the image we just saw, but some specialist scopes can have north of 50 parts. And in some cases, just one damaged part can affect the whole system, making it unusable. So the two most important functions of a scope, obviously one is to give you a clear visual image, and the second is to give you light. So both of these need to be to a correct specification to perform as they should. There's no point having a crystal clear image if there's no light to see that image. So I can have a basic look at some procedures, which procedures are used with rigid endoscopes. Laparoscopy. So here you can see most commonly lap scopes are 5 or 10 millimeters in diameter, and they're generally at a 0 degree field of view. As you can see there, the consultant or the surgeon has a lot more room to maneuver in the working area, which means that field of view isn't a problem. Arthroscopy. So arthro meaning joint. So this could be knee, shoulder, ankle, wrist. The main differences you'll notice, obviously, is the length of the scope. So the scope doesn't need to be a standard length because it's only going into a joint. So generally these would be around half the size or 180 millimeters in length. So cystoscopy. So these can be rigid or flexible. Rigid is a slightly wider cystoscope that doesn't bend and is used to perform biopsies or remove tumours. So yeah, my heart goes out to any of the guys there that have had to endure this. And hysteroscopy. So hysteroscopy is the exam of the inside of the cervix or uterus using a thin, lighted, semi-flexible tube. called a hysteroscope. So this can aid the surgeon when taking tissue samples, removing polyps or tumours, or destroying tissue using electric current. So as you probably already noticed, there's a common theme here, which is oscopy. But what is oscopy? So the basic translation of oscopy is to look inside. So just as an example, if we take cystoscopy, the word cyst comes from the Greek word kystis, meaning bag, pouch, or bladder. If you then add that as a prefix to oscopy, you get cystoscopy. So cyst, bladder, oscopy, to look inside the bladder. So moving on, as you can see, there are a few different design features and specifications for different scopes. And this is based on the procedure that they're used for. So lap scopes, as I said, generally 5 to 10 millimeters, giving the best clarity for abdominal surgery. Arthroscopes will be shorter in length, normally 4 millimeter diameter. Obviously, as we said, they don't need that overall length as they're going into a joint. A cystoscope, generally around 300 millimeters in length. As standard, they have smaller diameters because of the entry points to the body. And then finally, on the right-hand side here, the hysteroscope. So very small diameter, down to like 1.9 millimeters. These can also be what we call semi-flexible due to the nature of their use. So when we say semi-flexible, just to give you an insight, the construction of these is slightly different to a rigid endoscope. So these can be called semi-flexible, semi-rigid. So unlike a standard endoscope, which houses these rigid glass rod lenses, as we saw before, the image is actually transferred via fibre as well as the light. So that allows the scope to be flexible. Obviously, the downside of this is much more expensive to repair when it does go wrong, because you can't just change one lens, you have to refibre the whole scope. So as we move on, just going to look at a few common faults and hopefully help you to identify these if you're looking through your scopes. So fluid ingress, so this is probably the most popular one that we see with our repairs. On the before image, large spots are visible, which looks like almost raindrops. This is what we call fluid ingress. So rigid endoscopes, when functional, are watertight, as any sort of fluid ingress will compromise the integrity of the image. So fluid can enter from many points, such as the window located at the tip, the scope, and even the eyepiece. So broken rod lens. So again, another popular repair that we see in a lot. As we mentioned, some of these tiny rod lenses are made of glass. Not a lot of people are aware that that is inside the scope, and quite easy to damage. So on the before image, glare is visible, if you can see that in the top left, and it's distorted the image and made it out of focus. So as previously mentioned, endoscopes are made up of a series of tiny glass rod lenses. And the glare from that is created by a fractured glass. So obviously rod lenses are fragile, and this damage can occur if the scope is bent or dropped generally. So here's another example. We've seen some splintered glass rod lenses. So this is actually the top left-hand side here. This is still inside the scope. There is a technique that you can do where you can train your eye. So if you put your eye up to the window, the viewing window of the scope, and slowly draw it away, but keep your eye focused down the shaft, you can actually see the individual rod lenses. If you do it enough, you'll be able to pick up which rod lens is actually broken or cracked. So sprung rod lens. So on the before image, you can see the image is out of focus, blurry. At the tip of the scope of the optical system is what we call an objective. So this can be thought of as the main focusing lens for the optical system. It provides you with the required direction of view and the required field of view for the whole optical system. So an objective is comprised of really, really thin layers of glass and mirrors. And these layers over time can separate and cause the image to become like the before there, like blurred, out of focus. No image. So fairly self-explanatory. This could be sort of a mix of any of the previous faults, multiple broken rod lenses, a shaft completely snapped off, an angry surgeon, something like that. There's no real way of telling what this is until we get the scope open. So contamination. So a little bit similar to fluid ingress. So on the before image, you can see clarity is still present, but there's blotches, sort of contamination has appeared on the lens. So the contamination could be external, it could be internal. Externally, the contamination would only be on the window. So we'd always advise, if you ever see this, just give it a wipe over with a soft cloth, something like that, because that may solve the issue, just like that. The other side of it could be internal contamination, which is obviously a bigger problem. The contents of the endoscope are sprung loaded. So when the scope is sterilized at high temperatures, this can cause the tubing to expand slightly. So this expansion and retraction over time can cause particles to appear, and unfortunately it's unavoidable. So distal tip damage, this one's a little bit easier to see. Obviously on the before image of the scope, it has visible tip damage at the top here, and the light fibers have receded. So you can see these have either been burnt or hit by a shaver, something like that. This is generally damage that we see with an arthroscope. Anything that's used in close conjunction with diathermy or shavers, drills, things like that. Obviously, power tools don't mix too well with fine glass. So moving on, so another common fault is adhesive. So adhesive is used to keep the light fibers in place, and over time or with excessive light, these can discolor, so they can almost turn orangey or give you a warm white. Causes of this could be an incorrect light lead, so a much too powerful light lead, or the light source being turned up too high for that specification of scope. So the solution is obviously to use the specified light lead and the correct light source. Here we can see some more distal tip damage. So it's the end of the scope here. This has obviously been burnt by something or other, but again we can see the light fibers have gone completely black and receded. So this scope would have to be fully exploded, taken apart, and completely refibered. Bent shaft. So again, fairly self-explanatory. It may be that you've got a perfectly good issue, even though the shaft has a bend in it. So really, it's down to you whether you want to send your scopes for repair. We would always advise it, because you never know if it's going to fit within the sheath, cause more damage, or even injure the patient. So you can see there on the before image, got a slight bend in the side there. The before image, so we would have replaced the tubing, all new internals, brand new scope. So an example of light fibers and external light source. So again, going back to our two most important things, obviously our vision and our light. So here's an example of some light fibers. So much like, I don't know if anyone had a fiber optic Christmas tree as a kid. Similar thing, obviously much higher quality. So there's a few basic easy checks that you can do to test the light function of the scope. So you can hold the light post up to a light source. So this doesn't have to be a light lead. You could hold it up to a fluorescent light, ceiling light, anything like that, and that should show you transfer through the scope to the distal tip. What you can also do then is then reverse that. So hold the distal tip up to the light, and that should transfer light to your light post down here. If you do this and you see any black dots, this indicates that you've got broken fibers. And in extreme cases, light output will be completely black, showing a complete loss of light. This is obviously going to reduce any light flow through the scope. So here's an example for you here. Obviously, you can see a slight yellow-orange colour there. So this means obviously it's got some sort of adhesive damage. That would have to be refibered, because that's going to give you a warm white as opposed to a clear light that we see here. So you want a bright white light, nice crescent on the front there, no black dots, so no broken fibers. And here's our test again. So holding the distal tip up to a light, you can see the light post here, transferring that light down, again, no broken fibers. And then on the reverse, holding the light post up to the distal tip. So again, when we test the scopes, you can see here the difference in the discoloration. So you can see this is almost a warm white. Also, the light output's not great. So that would indicate that there is some broken fibers within that scope. What we want to see is on the right-hand side here. So we'd say hold the scope around 50mm from a white surface, and you should have a good even distribution of light. You can also see here that the light is off to one side. So if this is an arthroscope, that may be a 30 or a 70 degree, hence why that light is off to one side. So here we can see another example. So you can see on the right hand side, we have got the right color of light, but that is reduced. So again, that would tell me that there's broken fibers within that scope, and that needs to be tested. We'd always advise as well that you test your light leads and your light source, because it may be that that is the issue and not actually the scope. On the right hand side, again, exactly what we want to see. So how not to handle scopes. So obviously this is exaggerated, but these are all things that I've witnessed personally, one way or another. So people thinking they're Harry Potter. So I've seen people waving scopes around like a wand, which may seem fine, you know, on a larger laparoscope, a 10mm scope. Obviously these seem like robust instruments, but could easily be damaged under their own weight. So if you were to hold a scope at a distal tip, which is what I've seen, pass it to someone, wave it around, you know, the weight of the body of the scope could potentially crack a rod lens and damage the internals in that system. So we just say always hold the scope by the body, not by the shaft. Don't know if anyone remembers the famous Cadbury advert with the gorilla drumming. This is something that I saw at a decontamination unit. It was a young lad who had two scopes in his hand, and he was air drumming and then proceeded to move on to his workstation. No prizes for guessing sort of how that ended, but obviously fragile glass on a metal table ended how you would think it did. And finally, so I've seen this several times, obviously, as we've explained already, some of these glass lenses fibers are tiny, and it doesn't take a lot of contact damage to damage those. So if you're, you know, dropping a scope from 6 inches into a basket or onto instruments, onto a table, again, that could damage the internals of a scope. So just always be aware when you're handling these. So a few checks that you can perform when receiving a rigid scope back. So check the image. Obviously, the most obvious one, look through the scope. Is the image round? Is the image sharp? Does it have good color definition? Check the shaft for straightness and dent. So look along the shaft of the eyepiece from the distal tip. Hold the light post down, and this will give you a reference point for if that shaft is bent or not. You can look along the shaft from the eyepiece to the distal tip with the light post pointing left. Again, this will give you a good reference if there is any bends in that. Feel the distal tip is sharp. Look for dents, cracks, anything like that. As well, as I mentioned, so definitely worth checking your light leads, your light sources, to make sure they are not failing. So there are correct light leads that should be used with correct scopes. There's a quick breakdown there. So this is saying you can cause internal damage to the fibers or adhesives. If you were to put a 4.8mm light lead onto a tiny hysteroscope, whack the light through it, you're going to burn those fibers out. Obviously, it's not going to happen instantly, but over time, that will cause ongoing damage. So, as I said, there are light lead testers available. You can also test this in a similar way to the scopes. So you can hold your scopes up to a light source, put your thumb over one end and watch the transfer. Make sure there's no black dots, which indicates broken fibers. Or you can use a light lead test like this, which will give you a percentage reading on your leads. So fixation and transport of scopes, this is another important one. So wherever you're sending your scopes for repair, service, anything like that, are they in the correct boxes for transit? So although a scope may already be damaged and you're sending it off for repair, further damage could occur during transit, which in turn increases the repair cost potentially lead times, things like that. So make sure you have the correct boxes, they are packed up correctly when you send them away. If you're sending them in scope baskets, make sure the baskets are the correct size and of a good quality. So again, making sure your baskets are suitable, you're not just putting them in a basket full of instruments. We've seen arthroscopes put in with mallets, osteotomes, things like that, just rolling around in an open basket. Another thing to look out for is obviously fixation is different depending on the design of the scope. So you wouldn't want to be pushing a 10mm laparoscope into a 5mm fixing because you could potentially damage that scope again. So always have a specified basket per scope. So another thing that your service provider should be offering is scope audits. So these can be carried out on site, and these offer many advantages. Obviously, auditing your scope is a great preventative maintenance measure. So this can identify trends, which you can then train staff how you can potentially stop those trends reoccurring. And most importantly, just ensure that your scopes are in full working order, as this will avoid delays, sort of cancellation of cases, anything like that. So a sort of a mini audit that you could potentially do yourself is our Think Twice acronym. So check the tip of the endoscope for sharpness, as we just said, any types of damage to the tube, such as dents or cracks, windows. So you've got the distal window and you've got the proximal window. Make sure the windows and the tip of the eyepiece are free from dirt and cracks. So what may look like internal contamination may just be on the tip, as we said. Illumination, so hold the scope up to the light post to the light and make sure you've got a bright, clear light all the way to the tip. Clarity, again, most importantly, to look through the eyepiece. Is the image clear, free from shadows, dots, lines, cracks, everything like that. And finally, environment. So if you think twice and the endoscope isn't suitable for use, then please think of the environment and choose to repair over replace. Obviously, a lot of times the repairs that we see may be one broken lens. What you don't want to do is replace a whole scope for the sake of one lens. Obviously, it's going to cost you a lot more money. And studies have shown that it takes 50% more energy to replace than it does to repair. So think of the environment, very important. There's also substantial savings to be made with this, obviously. And remember, just because it's a new scope doesn't mean it's not going to break the same as a repaired or refurbished scope. It's still got the same internals. It's still liable to break. So thank you very much for your time today. It's a little bit shorter than we expected, but I've just put up a short clip on screen here. So this is the next session that is available, which will be hosted by Nick Williams on the 6th of June. So this is an overview of flexible endoscopy. So if you use the QR code on screen there, and they'll sign you up for the next free session with Surgical Holdings. I'll put this back up on the screen in a minute. In the meantime, has there been any questions, Dan?
Mark, thank you. That was great coverage of all of the key areas there, including the explainer up front around the procedures, which was really helpful. There haven't been actually too many questions, and I'm just having a look now. There's just a general question around sharing the slide deck, which we can of course make available. There was a comment from Awan around whether Smith & Nephew scopes can be audited too. So yeah, they can be audited. That's something that we would cover, Mark, isn't it? As
yep.
Generally most common brands, really. I would say, Mark. So Tim's just made a comment around what's the most common fault we see with scopes. Did you want to pick that up, please?
Yeah, so I'd say it's probably one or two. So either moisture ingress, moisture or fluid within the scope system, or broken rod lenses. So things from contact damage. So if the scope's been hit with something or dropped, they're probably the most common repairs that we would see.
Okay, Great. And Stephen's asked, are rigid scopes routinely sent back for maintenance? So I'm guessing like more of a service, or are they sent back when they're faulty?
Yeah, I mean we've got customers that use a sort of service, but generally it's done ad hoc as they break. So that's why we mentioned about the auditing sort of as part of an added service as preventative maintenance. Because if you pick up certain things like contamination, if you don't pick that up early, that could then spread throughout the whole system, which would then need to be replaced. So very, very important that you are either auditing your scopes yourself or you have a service that's done for you.
Yep, good. And another question just around effectiveness of repairing light cables. Now that's not something that we tend to do. Sorry, cost effectiveness. Probably not particularly cost effective, I would say, from my perception. But Mark, that's not something generally that you've seen too much repairing of the actual light cables themselves.
No, I don't think so. Yeah, we very rarely get asked to repair anymore. Obviously, like Dan said, there's not much incentive to buy a new to have them repaired when a new one is not much more. So yeah, generally people just replace them.
Right, that's good. Kim has asked if it's been recorded. Yes, this has been recorded, and we'll be sharing a link to the recording after. Some kind comments about the content, and it's been useful, so much appreciated. If there's any more questions that anyone wants to get in, please stick them on the chat. One thing, I've written down a couple of comments, most of which you covered, Mark, actually, but one was just really around the importance of the light cables, and just reiterating that, really, because quite often that gets overlooked. And I've particularly seen where bigger cables have been put on smaller diameter scopes, and that's really has caused problems. And I think maybe it's not necessarily realised how much the extra power flowing through the light cable and the damage that can do to the scope itself. That can result in a major repair. So that is something to be aware of. But also, quite often we've seen when scopes have come in, and again, as you've highlighted, in baskets that are perceived to protect them, but actually probably doing them more damage than protecting them, Mark.
Yeah, exactly. Yeah, something we've seen a few times. Like we said, it's been sent to us damaged, but it's now effectively twice as bad when it gets to us. And it's goes from a minor repair to a major repair, which could be avoided. Yeah,
that's it. You want to do anything you can to obviously avoid that. And I think as a company, we've been pretty proactive regarding the circular economy and the Green Theatre checklist, and a big element of that for me is being preventative. And we don't want to have to repair scopes if we can avoid having them damaged through education like this, or just really some basic maintenance. So we've got a couple of other questions. So is it possible to prevent water ingress, or at least reduce the occurrence? I don't know if that's something you can pick up, Mark, or you can add some comment to. We've also got one of our colleagues, Jack, who's our lead technician, on the chat as well. He might have some input on that.
Yeah, I mean, from what I know, it's unfortunately a flawed design, isn't it? A scope, it's not sort of designed for longevity. So at some point, it's gonna break, it's gonna leak. It's just down to how it's handled, how it's sterilised, how it's looked after, really. But I couldn't put a sort of time scale on it with moisture ingress. I'd have Jack. You got anything else?
While Jack's typing, I'll just mention another one's got another colleague here on the chat has just asked about is there a way for sterile services technicians to check high flow scopes? Now, no, this is a particular model scope, but yeah, there would be a way, as Mark has described, to check the basics around the rod lenses. I mean, we've got that TWICE acronym that you can certainly utilize for some of the basic checks. Equally, a session for wider staff in the department, or a physical staff, which a physical session, Mark, which is good, getting the scopes in hand and actually looking at the webinars are great, but to actually get the scopes in your hand and have a proper visual look is really useful as well, isn't it?
Yeah, that's it. So yeah, we've got a lot of training materials, and it's a bit more of a tactile session. So like Dan said, we bring along scopes. You can physically see the internals, hold the rod lenses, the fibres. Just gives staff a much higher appreciation of what is inside these and how fragile they are. So yeah, please do use us for that. Again, it's completely free. We'll just come on site. We can even do multiple sessions if you've got a lot of staff.
Yeah, no, it normally goes well. Dawn has said, are theatre staff educated on the correct use of light cables versus scopes being used? Well, it's difficult to say, and that's why we sort of tend to try to reiterate it in these sort of sessions, because I suppose the theatre staff are going to probably grab whatever cable is on the tray, and maybe may not realise that if the scope, if a cable is a higher diameter, if the tray is set up and it has the wrong. So I think it's about sharing that information really, and just being aware that how important that is. So Jack had put about kindly added a comment about preventing water ingress. But there's no active preventatives, but always pay attention to chemicals used during the cleaning process, as they can potentially affect the solder joint. So that is something to bear in mind. Of course, there are different cleaning chemicals, some of them more aggressive than others. There's also water to bear in mind, water quality and different minerals you get in the water. So these are all some natural and some artificial ways that potentially can break down that scope that will just happen during the reprocessing of it. Anything to add on that, Mark?
No, just going back to the light lead comment. Couple of solutions that I have seen is obviously labelling up in theatres of the diameter of light leads, and then a list below of scopes they should be used with. And the only other option being the coloured light leads. So for identification, just to make it as easy as possible, having a certain colour light lead per diameter stops any confusion.
Yeah, seems a great way and an easy visual to be able to do that. So there's been a comment around, is it common for finer telescopes to break, and more often than others? And I think Jack's added a comment that the 2 to 3 mil scopes are more fragile, and the other ones are more robust. 2 to 3 mil are easily bent, causing broken optics. So that's obviously, I think, perhaps Mark, even more so when you're handling those smaller diameters, to be very cautious.
Yes, definitely. Yeah. So I think again, this just comes with education. Like we said, I don't think people are really aware of what are inside these scopes, and from the outside, it looks like a stainless steel instrument. But there are these fine internals. So again, that's why we're having a big push on the education side of things.
And an interesting comment here at the bottom, that scopes are expensive, and that some trusts work with agency staff which may not necessarily be trained on the scopes and light cable safety. So again, how do we prevent breakages through that? But I think that's just trying to extend education. And I was trying to think whether there are safeguards could be put in place. I think the colour cabling on the that you've mentioned on the light leads is useful, but I'm trying to think how else you could safeguard against this damage if it's untrained people that may not be necessarily trained, as well as the staff that are in the department every day. Like how can we prevent damage just through poor handling? But I know I'm struggling on this unless there is a degree of education that probably shouldn't be touching those scopes.
Yeah, there is no real. It's a tricky one, isn't it, with the sort of turnover of agency? It's not impossible to train everyone, but it's very time consuming. If you train someone, they leave the next day, you're kind of back to square one. So that's a tough one. Good question.
Yeah, no, it's a good question, because you want to safeguard against any eventuality if you can. But I think things like ensuring you've got the correct size protective baskets, perhaps, and obviously perhaps distributing posters and educational materials around the departments. I mean, we've got some nice mats which give training information on this. So if you're packing, you can keep an eye on those key issues. So Jack's just made a comment that as a trusted repairer, we will do what we can to highlight trends and common occurrences, but the hospital must also do what they can to educate, which is a good comment. Dawn's added sterile services technicians are usually blamed for damage in order to spot the incorrect use of cables. Is there a chart available in CSSD? We would be able to identify the incorrect likely. Yeah, I mean that's something that that we can probably come up with if that would be of use. Let's see if there's any other questions that I've missed. Make sure there's nothing on the Q&A. Nothing on the Q&A. As we said, your certificates will come out after the session, and if there's any questions in the meantime, please feel free to send them over. Please register using the QR that you can see on the screen, as Mark said, for the next session, which is on flexible endoscopy. And then we're going to be releasing information on future sessions as well. As there don't appear to be any more questions added, Mark. No. So thank you everyone from me for attending. Much appreciated. Thanks for Mark for a great presentation there.
Yeah, thank you everyone. Appreciate your time. Obviously, if you've got any questions that you think of after we come off, then just my email's at the bottom there. Just let me know and we can always come back to you with the answers.
Good stuff. Thank you everyone and enjoy the rest of your day.
Thanks.